Hello, I'm Norbert Gleicher, MD, Medical Director and Chief Scientist here at the Center for Human Reproduction. We got recently a very interesting question. And the question was, can a woman outgrow PCOS, polycystic ovary syndrome? And this is a very interesting question because the answer is it depends. In order to answer this question, I have to first explain a little bit about what PCOS really is. Polycystic ovary syndrome, as the term syndrome already indicates, is not a disease. A syndrome is a condition or a group of conditions, to be more accurate, which are kind of put together into the same basket because of common denominators. And that's what PCOS is. So I don't want anybody out there listening to this explanation to believe that PCOS is one disease. It is not. And this is already the problem, because even though it has been known for decades that PCOS is not one disease, we don't even know up to this day, or I should better say, we cannot agree, we experts cannot agree, on how many conditions really make up PCOS. We here at the Center for Human Reproduction, based on our own clinical research, have concluded that it is 2 conditions. Most people still believe it's 4 conditions. Our colleagues at Mount Sinai up Madison Avenue, through genetic studies, came also to the conclusion that it is 2 conditions. But whatever it is important to understand that those conditions, while they have a lot of common denominators, they also have major differences. And I think those differences are most obvious if one assumes that PCOS actually, as we here at the CHR do, that PCOS really is basically a 2-condition condition. There is a universal belief that PCOS, in all of its conditions, is characterized by high androgen hormones. Those are the male hormones. And indeed, that is true, except that our colleagues who believe that PCOS is made up of 4 conditions believe that there's one amongst those conditions, the so-called D phenotype, the others are A, B, and C, which really is not hyperandrogenic, which does not have high androgens. But those colleagues are wrong, as we discovered a few years ago and reported in the literature, because what these colleagues have overlooked is that women in that subgroup of PCOS at very young ages, meaning between menarche and maybe age 20 to 25, also are hyperandrogenic. They just start dropping their androgen levels after age 20, and therefore, between ages 25 and 35, when most PCOS diagnoses are made, they are in normal range with their androgens, and that's why when this 4-group constellation was first established, these women were considered normoandrogenic, meaning having normal androgens. Why am I explaining all of this? Because this group especially changes their PCOS pattern as they get older. Everybody starts out with high androgen levels. But the vast majority remain high. While we all drop our hormone levels as we get older, androgen hormones also drop. But they always remain high in these women for their age. The only exception is the subgroup of PCOS women, which in the 4-group classification is called the D phenotype. These women, as I already mentioned, start dropping the androgen levels. And between 25 and 35, they are in normal range, and then after 35, they come out at the other side of the normal range, and they become actually hypoandrogenic, meaning their male hormone levels are abnormally low. And this is where they get into problems and come to us. Because ovaries need good androgen levels. And if androgen levels drop, these women will have a very hard time to get pregnant, even a hard time to get pregnant with IVF. And one of the reasons is because most of our colleagues don't even look at androgen levels in infertile women. And in those women, obviously, with age, their PCOS changes. And that needs to be recognized because they, paradoxically, even though they, when they were young, had very high androgens, they now need androgens to get back into normal range and in order to get pregnant. For all the other women, that is with PCOS, that is not the case. Two more points. All the other women, in other words, the A, B, and C group of women under the 4-group selection process, they are all at risk for what is called the metabolic syndrome, which is a fancy term for high blood pressure, diabetes, and heart disease. In other words, A, B, and C PCOS phenotypes have that risk. Once again, the D phenotype does not. But the D phenotype has another risk, highly associated with it, and that is what we call a hyperactive immune system. That can be autoimmunity, it can be inflammation, it can be just being hyperallergic. And all of these conditions increase the miscarriage risk, and therefore this again is a very important point of distinction for this patient group because they need to be treated so different from all the other PCOS patients, even though they are also PCOS patients. I hope I have answered the very simple question with a very complicated answer. Thanks for listening.